Hello everyone, it's James from Newcastle Podiatry again, and today we're going to talk a little bit about why you should see a podiatrist instead of just going to the high street and paying for a pedicure at a beauty salon. A lot of people don't know what we do as a profession and why you should choose us, okay? So a lot of the time people see us, we come to your house, we cut your toenails, and people wonder, what are we doing? What is the difference? So I'm going to talk to you about that today. So, why should you trust a podiatrist with the health of your feet? So to become a podiatrist these days, you have to go to university for 3 years, and we have to do dissertations and study and the feet, knees, and all the way up to the hip these days. So we actually work in clinical practice for over 1,000 hours under the supervision of a lecturer to become a podiatrist, okay? So it's not as simple as just picking up some instruments and cutting toenails, okay? We do a lot of in-depth study, okay? One of the important things that we do is what's called a vascular assessment. So when we're looking at your feet, we're not just looking at the toenails, we're looking to see how good is the blood supply getting from your heart down to the feet, okay? This is really important. So one of the techniques that we use is called palpation. So when we've got your foot like this, we can place our fingers around the foot, and this is quite a difficult technique, but we feel for the blood vessels, okay? So when we're doing this, we're seeing how good does the blood flow get from the heart to your feet, and is the blood flow quality good, okay? But we can tell you a bit more about this at your appointment, okay? The next thing that we're looking for is the venous return. So this is the blood getting from the toes back up to your heart, okay? And your veins are basically the little blue ones that you see on the surface of your skin. Signs that you've got venous problems are you may see varicose veins. In elderly people, you sometimes see what we call telangiectasia, so these little spidery veins. So they're not usually anything to worry about, but these are the things that we're assessing when we're looking at your foot health, okay? The next thing that we're looking at is if you do have venous problems, you sometimes have edema, so this is swelling of the leg, okay? There's a lot of risk factors associated with edema, and we can sort of advise you on what to do if you are having problems with edema. Also, being a podiatrist, we have to pay quite a lot of money to become insured so that when we're doing the treatment, it's safe and we're registered with the correct healthcare bodies, okay? So we always recommend, if you're looking for a podiatrist, you need to go online, type in the Health and Care Professions Council, and then just type in your podiatrist surname, whoever you're getting. What this does is it means that they've completed their degree and they've registered with the healthcare board and they're in good standing, okay? So make sure your podiatrist is registered. The next thing that we do is look at biomechanical issues with the feet. So as a podiatrist, when you build up a database in your head of all the thousands of feet that you've seen over the years, you can spot problems before you're likely to spot them. So we can give you advice on how to avoid ulcerations, how to avoid pain. We basically look for things that you wouldn't know to look for. Okay, next thing, diabetic advice. In recent years, podiatry has become really diabetic focused. So if you're a diabetic, you need to be always having your yearly diabetic annual review. As I mentioned, we're checking the nerve supply to your feet, we're checking the vascular, we're looking at the biomechanics of how your feet's working, just to make sure that the risk of wounds and also ultimately amputation, if not managed correctly, is managed, okay? So you need to see your podiatrist regularly for your assessments. As I mentioned, we're looking for problems that you may not be noticing for. And also, we just teach you how to look after your feet, okay? Our job isn't to look after your feet completely, it's to empower you to look after your feet yourself, okay? So none of this expert advice you get from just going to the high street and getting a pedicure, okay? So if you've got any questions about your feet or you're unsure what we can do, just get in touch. Newcastle Podiatry is a home visit service, and if you want to make an appointment, you just ring up and we'll see when we're available.